I believe we are live. So Lily, the floor is yours. I think you are muted if you are trying to talk.
Hello. Hi, everyone. Sorry for a delay. We are happy to have you here on the 7th session of Funding Continue Today initiative, and we hope you're fine. My name is Lily. I'm from Funding Box team, and right now we are starting a webinar, How can medical solutions based on an automotive tool help hospitals? For that, we invited Sławomir Potash. He's the CEO and founder of InMotion Labs, a Polish company developing car scanner, ANPR InMotion, and MEDIbot. He studied mechatronic design at AGH University of Science and Technology in Krakow, in Poland. So today, Sławomir will tell us about tools like car scanner and MEDIbot. So please feel free to write your questions in the YouTube chat during or after the webinar. So after the presentation, I will read it to Sławek and he will be able to answer it. So hello, Sławek. It's really happy. We're really happy to have you here. Thank you for coming.
Thank you for having me.
Yeah. So you can share your presentation here.
Sure. Okay. So just please give me a sec to share my screen.
Okay.
Okay. Yeah. Can you see my screen right now?
Yes, but yeah, just make a full screen and it will be good. Yeah.
Great. Yeah. Thank you. So what we are developing is a solution that is aimed at the automotive scene to pretty much make a 360-degree documentation of cars. And the way it works is that we actually have a robot that automatically goes around the car using a magnetic strip as a navigation of around the car. And the way it works is that it makes high quality documentation, but it also have like a module that enables people to actually make an interior documentation of the car's body. And after the documentation is being generated, it is sent to the cloud, synchronized, analyzed, and then the end result is generated, the report itself. And the way it works is that it provides like a good standardized exterior view of used vehicles, as well as opened doors documentation to actually see used vehicle online. It also enables for a good looking interactive interior view, which pretty much creates some kind of nice 360-degree documentation of used vehicle. What's more, it also provides a consistent imagery across multiple used vehicles, which is great like for used car auctions and also dealerships. And this is some solution that's pretty much aimed at those high volume facilities that are processing used cars. And having this in mind, actually to get this idea somehow market validated and founded, we had a chance to be accelerated by Impact Accelerator here in Poland, which provided us the ability to actually test our idea, our solution with a company receiving our technology, which was Motoflota. This was fleet management company that was eager to know whether this solution works, how it works, and to actually do a deployment of 20 units across Poland to actually check its product viability. And having this in mind, we actually conducted a 3-month trial process that enabled us to actually better understand the product. And what we gained from the accelerator, the benefits were, first of all, the possibility, of course, to develop those 20 units, test them on the market, and having said that, to actually validate it with customers. What's more, it also enabled us to actually have a certain, I would say, product roadmap around things like its viability in the car services, as well as features that are missing, as well as if the idea is good enough to be further commercialized, or they think that the use case, the market segment doesn't work at all. So having this in mind, it's definitely something that we highly recommend because it enables pretty much a company to go from pretty much early stage to a market validation quite fast. And this is one of the pictures of the deployments that we did. So this is pretty much one of the car dealerships in Poland. And the way it works is that the robot goes automatically around the car and provides the documentation. So after this, we've been able to secure a pilot project also with Porsche on the further, I would say, idea of this project, how it works, and actually some additional features. So it's definitely some kind of outcome also from the acceleration program that we've been able to get better market understanding. And actually, the way it works is that in Q4 2019, we've started a commercialization, I would say test commercialization with Impact Accelerator, and at the same time, we also did a POC with Porsche. And pretty much based on the feedback that we gathered, we started development of 2.0 version in February. And pretty much this month, we received an R&D grant for further development from the Polish National Agency of Research. And having this in mind, pretty much that was something that we've been developing, but COVID-19 happened. And what it did is, first of all, it definitely put a massive, I would say, downturn for all the economics and for small startups like ours. So we decided that there's definitely something that we could do actually around coronavirus and helping people out. So the problem that we realized back in March was that Poland had the highest percentage of medical staff getting infected while curing patients in hospitals. So to put numbers, pretty much 19%, if I do recall correctly, 19% of all medical staff in Poland got infected while treating patients in Polish hospitals. So we thought that there must be some kind of a way actually to treat this and to help patients not infect the doctors. And we thought that because we do have some experience with moving stuff around using some actuators and motors and things like that, we could actually provide some kind of robot, like, for example, guys in Italy did, to help in those situations and to actually mitigate the risk of getting infected and to introduce some kind of prevention by robotizing some of the features, some of the actual tasks that are recurring tasks in hospitals. So we did a market research around what was available in the market, and there were those video consultation robots available, for example, that were deployed in Italy. There were also food delivery robots that I think were deployed also in Southeast Asia around food delivery. And the third type of robots, so those were those UVC light robots that were doing disinfection of the areas. So that was like the state of the art around what's right now happening in the market of COVID-19 robotics. So what's more, also major players in the automotive industry also shifted their I would say focus into helping fight COVID-19 to ramp up production of ventilators and things like that. So we actually thought that we would provide in some kind of short sprint a robot that's being controlled using a web platform and a local Wi-Fi to actually enable doctors, while having, like, let's say, PlayStation pad, to remotely control the robot and actually help the infected patients remotely. And what we decided to do was to actually chop off the top part of our existing robot that we've developed together with Impact, and actually to replace the top part of the robot with medical equipment and see if it's a viable use case for the patients. So the features that we thought are a must-have are, first of all, disinfection, so that way the robot itself doesn't infect the patients and the doctors. The second thing was the possibility to do food and drugs delivery from doctors, from medical staff, to the infected patients that are lying in the beds. Third of all, video consultations, which would actually enable remote conversation between the doctor and the patient. Fourth of all, remote control, which would enable actually the robot to be cheap, in a meaning that it would not go out autonomously around the hospitals which pretty much enables us to lower the cost of the robot. And last but not least, medical inspection. So things that actually make it possible to inspect the patient's body remotely. So things like oximeter to check the saturation of the blood, so the level of oxygen in the blood, as well as heart rate monitor, thermal vision camera, and digital stethoscope. So having all those features combined, what we come up with is something that we call MEDIbot. So this is like a 10-week sprint project that we decided to do quickly, to deploy it in the hospitals, and that's like the early stage render of our solution. And the way it works is that, first of all, the robot can go to actual patient while being remotely controlled. It has this arm that can swing up and down to adjust itself to the height of the bed and to the head of the patient. Our general assumption is that we would focus on the patients that are awake, that are in a good enough condition to actually have an interaction with the robot. And the robot would have oximeter, digital stethoscope, food tray for medicine and for food and for water, and also digital thermal vision camera that's underneath the tray, and the tablet to actually provide a cheap and easy way to communicate between the doctor and the patient. And the robot, after having an interaction with the patient, would be driven into the disinfection station that would automatically decontaminate the robot and also its payload within just 2 to 3 minutes. And afterwards, the robot clean can go back to the doctor. The doctor controls it using regular computer joystick, and then he can actually add some additional payload or something like that. So this is, for example, a video of our prototype that we developed in like roughly 8 weeks, and this is a demonstration that shows how the robot looks and how the robot works. So the way it's being controlled is a regular PlayStation pad, and the robot itself transmits the video to the doctor so that way he can navigate. And then the doctor has this ability to actually measure the temperature of the patient, to have the video call, and also to actually make some simple medical checks. So that's something that we're right now doing. And actually, we are hoping to have like first hospital deployments within next 14 days from now. That's the like close-up shot of the robot itself. Yeah, here's also a video from yesterday from the Polish Prime Minister checking out what's going on with our robot as he was visiting yesterday Łódź in Poland, where we had the chance to demonstrate this very quick product that we came up with to help fight COVID-19. So we're looking at first deployments pretty much within next 14 days. And yeah, thank you so much for your attention.
Thank you, Sławek. It was really inspiring and a really great presentation. I wish you good luck with your MEDIbot. I hope it will be really helpful for patients and for doctors as well, and not only in Poland. Yeah, so if I will check the chat now, maybe someone has some question. Okay, there is one question. Where do you see the main investments being spent in your area?
So if you could just repeat the question, so
where do you see the main investments being spent in your area? I guess it's about the MEDIbot product. Yeah,
sure. So actually, the way it works is that we've been able to secure a small investment from Polish government via exactly the same I would say program as this one, the Impact of Funding Box, to actually develop that. And the most of the investment went into actual development of the robot, and we have like zero profit margin on that. So actually, it's like with zero profit margin, and the way it was spent, it was actually on doing the prototypes, as we are doing like 3 prototypes, as well as developing further technology for that. So things like integration with digital stethoscope, and also making a remote communication between the robot itself and the laptop of the doctor.
Okay. I'll check if there are any other questions. For now, no. Maybe let's wait a few seconds. Maybe someone is typing.
Maybe I have a question a bit more generic, but that could be interesting for our audience. For you as an entrepreneur, what has been your biggest challenges? Could you also provide a couple of tips of learning that you have gained in the last times?
Yeah, sure. So 3 things I would say. First of all, watch out who are you collaborating with, because we do have like, plenty of mistakes that we did in the past. We also have like, some debts in our company that we right now try to repay and things like that due to, I would say, trusting to wrong people. So that's definitely be cautious about who you work with. That's one thing. Then the second thing is that definitely it's like being an entrepreneur is definitely a huge hit actually for your mental health, for your physics and everything. I mean, there are countless times when you get a massive hit. So being an entrepreneur is some kind of sine wave. So you really need to be, I would say, ready for that. That even if you have like the best possible intentions, thing can work out exactly the opposite way. Sometimes due to reasons that are completely, out of your control. So that's definitely something. This mental health part, it's extremely difficult also to tackle so many times. And third thing is that I would say right now with coronavirus, it's definitely something that changes so many different, I would say, aspects of our general life that everybody has to, I would say, somehow adjust to a new post-COVID world. And what I mean by that is, first of all, for example, there are some areas in the market that will change, or pretty much, I would say, they will not exist anymore. Like, for example, right now, for example, in Poland, like 40% of taxi drivers in the cities are having like huge debts, and they stopped working. They pretty much halted their services delivery due to that. So that's like a huge hit. But at the same time, for example, e-commerce is growing like crazy. So I would just try to advise everyone to look for opportunities and to try to figure out a way to actually have a company that will be still viable in a post-COVID world.
Very good. Thank you very much.
Thank you.
Thank you, Sobek. It was really a great presentation. Thank you for being here with us. And yeah, we hope that like you will achieve success with the MEDIbot, and yeah, not only in Poland. So thank you so much.
Thank you so much, and stay safe, everyone. Bye-bye.
Stay safe also.
Bye-bye.
Bye-bye.
Thank you. Bye.